Good day everyone. I'll be your teacher for today and I'll be the one to discuss the Vibrio Alginolyticus. By the way, I'm Vanessa Batua. Let's start. For this topic, we have 5 objectives. The first one is the student must identify the basic characteristic of Vibrio Alginolyticus. The second one is explain the bacterium mode of transmission. 3. Discuss the associated diseases caused by this bacterium. 4. To be able to find out the treatment of the diseases. And the last one is the different tests for the identification of treatments. We also have the course outline for this. We have 2 course outline. The first one is the introduction, identification and characteristic of Vibrio Alginolyticus and the mode of transmission. And the second one is therapeutic features. We have the symptoms, different tests, diagnosis or diagnosed, and the last one is the treatments. For the introduction, Vibrio Alginolyticus is a gram-negative marine bacterium. It is biochemically similar to V. parahemolyticus. But the Vibrio Alginolyticus is fermented with sucrose, while the V. parahemolyticus not fermented with sucrose. So what makes the V. Alginolyticus different from the other Vibrios? So let's find out. As a result of its presence in most seawater, this Vibrio has a value as an indicator organisms for cooked seafoods, but it does not cause the gastroenteritis in humans. So what is the main cause of gastroenteritis? Pag hindi na So what is the main cause of the gastroenteritis if hindi naman si V. alginolyticus? So the main cause of the gastroenteritis is Vibrio mimicus. But gastroenteritis is a associated disease for a V. alginolyticus. We have the characteristic of V. alginolyticus. Number 1, the first characteristic is si V. alginolyticus is halophilic bacteria. Halophils came from the Greek word salt-loving. So si V. alginolyticus is a salt lover. So usually makikita nyo sila Vibrio sa salty water especially sa dagat because dagat is a salty water. So the second one is fails to grow on clad agar but grows in the presence of 10% sodium chloride. So why V. alginolyticus fails to grow in clad? So ano nga ba ang clad? Clad is a crystalline lactose electrolyte deficient agar. So si clad is a differential culture medium for use in isolating and enumerating bacteria from urine. So why V. alginolyticus grows in the presence of 10% sodium chloride? As I mentioned a while ago, si V. alginolyticus is a salty lover. So from the word sodium chloride are commonly known salt. That is why hindi siya nafe-fail na mag-grow sa 10% sodium chloride. So the next one is facultatively anaerobic gram-negative bacilli with a single polar flagellum. So si V. alginolyticus is anaerobic gram-negative bacilli with a single polar flagellum. Next is associated disease caused by bacterium, symptoms, and treatments. So number 1 disease is otitis externa. So what is otitis externa? Otitis externa is a condition that causes inflammation or redness and swelling, swelling of the external air canal, which is the tube between the outer ear and eardrum. Otitis externa, also known, are referred to as a swimmer's ear because repeated exposure to the water can make the air canal vulnerable to inflammation. So, if you were a swimmer, prone ka sa ganitong sakit. So, what is the symptoms of this disease? We have the pain and swelling of the air canal, as a while ago I mentioned it. So, ano nga bang treatment ni otitis externa? We have the air drop, ceprofloxacin, and dexamethasone. I have a picture here sa gilid. So, ceprofloxacin and dexamethasone is a combination of antibiotic and other medicine. So the next associated disease is the gastroenteritis. So what is gastroenteritis? Gastroenteritis is a short-term illness triggered by the infection and inflammation of the digestive system. So ano nga ba ang symptoms ni gastroenteritis? The symptoms is abdominal cramps, diarrhea, and vomiting. So if you had an history or may history ka na nag-swimming ka sa salty water, then after that, experience ka ng abdominal cramps, diarrhea, and vomiting, there is a possibility na na-infect ka or may bacteria na nakapasok sa iyo, which is the Vibrio Alginolyticus. So, ano nga bang treatment for this disease? We have the intravenous fluid replacement and antibiotics. Intravenous fluid replacement because, syempre, nag-i-excrete ka lang parate. Diarrhea, excrete ka ng excrete. Wala ka namang ini-enjoy. So, you need an intravenous fluid replacement because dehydrated ka na. For the antibiotics, hindi ka makakatake ng antibiotics if not prescribed by the doctor because the pharmacy wouldn't let you buy. Siguro if you get hospitalized, you can intake antibiotics because prescribed by the doctor. The next is the mode of transmissions. See water through open wound. See, halophilic vibrios are increasingly recognized as important intestinal and intra-intestinal pathogens. So, infection of halophilic vibrios are generally acquired through ingestion of contaminated shellfish or seafood or by direct invasion through wound. So, pag may wound ka, open wound ka, then sumulong ka, nag-swim ka sa salty water, there's a possibility na mapapasukan ng bacteria yung open wound mo na yon, which is Vibrio Alginolyticus. So, same as sa ingesting a raw and cooked seafood. The bacteria syempre si raw food and si cooked seafood, galing talaga yan sila sa salty water. So, usually, diba, ang seafoods is galing sa dagat. Marami pa namang mahilig sa atin kumain ng raw food, especially sa mga Koreans. They really love to enjoy raw food. They really love to eat raw food. The next slide is therapeutic features. We have the different tests. The first test to run, or the first test, is oxidation fermentation test or oxidative fermentative test. Oxidative fermentative test was developed by Yu and Lapson in 1953. They developed OF media to differentiate between oxidative that produces acids from carbohydrates under aerobic conditions and fermentative that produces acids both aerobic and anaerobic conditions. So the next test is fecalysis. So ano ang tinitest sa fecalysis? So si patient na nakakaranas ng symptoms ng vibriosis is magpapasa ng stool sample sa laboratory. So, sino magra-run ng test? to medical technologies. So the next is diagnosis. Infection is diagnosed when Vibrio bacteria are found in the stool sample, wound, or blood of a patient who has symptoms of vibriosis. So after ni medical technologies i-run ang test, pag may na-found out o pag may naghanap siya ng bacteria sa stool sample na pinasa ni patient na nakakaranas ng symptoms ng vibriosis, is makakadiagnose sa physician ng infection. So, what is the treatment of V. alginolyticus? First is oral rehydration. Si the person na may symptoms ng vibriosis is dehydrated. So, need niya mag-intake ng plenty of liquids or water for rehydration or uh, intravenous replacement. The next is antibiotic. Infection caused by Vibrio alginolyticus can usually be treated in a short time with the right selection of antibiotic. But you could only intake antibiotic if prescribed by the doctor because the pharmacist won't let you buy antibiotics. So that would be all. Thank you for listening. If you have a clarification, just comment on this video. Thank you. Bye.